Hi everyone, I'm Congressman Jared Huffman. I want to thank you for joining me in the middle of this coronavirus pandemic for a very important virtual town hall. This is a time of firsts. I don't think any of us have been directly touched by a global deadly pandemic like we're living through right now. Another first, though, is I'm trying to have a town hall with some hybrid technology. I've done a ton of in-person town halls, I've done telephone town halls, but we're trying to combine live streaming through this Facebook Live technology, and I'm grateful for that opportunity. So I want to thank the Community Center of Marin, Community Media Center of Marin, for hosting us. I want to thank the Petaluma Community Access Channel for broadcasting this town hall on KPCA FM 103.3 and for streaming it on KPCA FM. I'd like to thank KSRO in Sonoma County for taping this program and airing it at 7 p.m. tonight on their station, and that's at 1350 AM and 103.5 FM. And I want to thank my esteemed panelists who are with me tonight, spaced at least 6 feet apart because we're taking some necessary social distancing measures in order to bring you this broadcast. I'll be introducing them in a moment, and I'll be asking them to speak whenever we have a question that touches on their expertise and their good work. So before we go any further, let me also thank all of you for taking the shelter-in-place rules so seriously, both the statewide directive and our local public health directives. These are really unprecedented measures that could seem extreme to some people, but here's the reality. The only way that we are going to contain this pandemic and keep our healthcare system from crashing is if we drastically reduce the spread of this virus. And while we do that, of course, we've got to dramatically increase our capacity to do testing. And if we're successful at those two things, and we won't know for a few more weeks, but if we succeed, we can begin to restore some normalcy to our economy and to our daily lives. I want to acknowledge the hardships and the sacrifices and the adjustments that I know all of you are making to comply with statewide and local shelter-in-place directives, with a special appreciation for our frontline healthcare workers and our first responders and others who are working hard because they're part of essential businesses where they have to continue showing up to work. The folks who collect our trash and recycling, the folks who are working in grocery stores and restaurants to protect our food supply. Thank you to all of you. And as a member of Congress, you might assume that my job is mostly going to Washington and just voting on legislation, but there's actually a lot more to it than that. My staff handles thousands of individual cases each year for constituents. We help people solve all kinds of problems with the federal government. A good example is the work we're doing right now because I have dozens of constituents who are stuck in foreign countries and trying to get home. Places like Peru, where they've closed the borders and where the COVID-19 virus is spreading. I've got lots of folks there that we're working with to try to get them home. We're working with the State Department and others to try to solve those problems. And while my staff is doing that work, they are actually working remotely from their own homes. I want you to know that they're doing that while sharing space with family members who are also either trying to work or learn from home, so they know the same kind of shelter-in-place challenges that all of you are living with. And I know too, because my work is challenged to adapt to a remote environment, but I can do it. I'm discussing legislation and policy issues with colleagues, making myself available to staff and others remotely. You would be amazed at how clumsy our conference calls are with the Democratic caucus. I've got over 230 colleagues, all of whom want to talk, and we try to have these conference calls every day or so, but we're making it work. And like many of you, I'm working full-time from home, and I'm competing for space. I will share with you that in my own home, I have a wife who's a public school teacher. She's trying to provide remote learning to her students. I have a sophomore in college who is home on what has become an open-ended spring break. She's trying to do remote learning and finish up her sophomore year while living at home with us. And then I have a teenager who has special needs and is trying to do remote learning with the kind of special accommodations that are necessary for kids like him, and only we can help him provide those accommodations. So it's a challenge. Many of you are negotiating much more difficult challenges, but I wanted to just share that to point out that we're all in this together and nobody gets a free pass. Now, probably the hardest adjustment I've had to make as your congressman is the part of my job that involves being present. I learned a lot about this during the firestorms that we've experienced in my district. I learned how important it is for victims and first responders to know that their representative in Congress cares and is there to bring empathy and listening and problem solving to help them get through some really tough times. With this COVID-19 crisis, I can't physically be there, and that's a challenge. So I am extremely grateful, again, to the Marin Media Center for making this studio available to let us at least try to connect by way of this broadcast. I'm also grateful to everyone who's helped spread the word about this virtual town hall tonight. I'm told that we have hundreds of people that are joining us from every part of my district, from the Golden Gate Bridge to the Oregon border. And so I'm anxious to get started. Let's begin by introducing the panelists who are with me tonight. Again, in the spirit of firsts, one of our panelists was going to be Marin County's excellent public health director, Matt Willis, but Matt himself has been diagnosed as positive for the COVID-19 virus. Thankfully, he's got a fantastic stand-in tonight, Dr. Lisa Santora, who is to my left, and she will be giving us her expertise from the public health perspective. To my right, I have Mary Jane Burke, who is the superintendent of schools here in Marin County, but more than just Marin, she's very active statewide as a leading superintendent in California, and probably more than any of her colleagues around the state, she was one of the first to experience this shelter-in-place reality and all of the challenges it brings for educators and for students. So she's here to speak to us about those issues. And then joining us by telephone is another panelist, Bill Kunst. He's from the U.S. Small Business Administration, or the SBA. And you may know that one of the things Congress has already done is make some new resources available through the SBA for small businesses. Bill is here to talk with us and answer any questions about that subject. So, just a quick word about how this program is going to go, and we'll dive right in. If you'd like to ask me a question, you can do that, or if you'd like to leave a comment, simply go to facebook.com/Rep Huffman. If you're seeing this streaming right now, you're already there, and you know what to do. We have already collected some questions from Facebook to get us started, so I'm going to take the moderator's prerogative, and I may interject some questions too. But we have about an hour together. We're going to cover a lot of questions, and if we don't get to your question tonight, we'll keep working at it. I plan to do weekly Facebook Live check-ins going forward, and I'll talk more about that a little bit later. So, I'd like to get us started. We have a question from Facebook, and it is for Mary Jane Burke. Chris is asking, what are schools doing to help first responders?
So the schools in our community, in collaboration with Department of Public Health and our Office of Emergency Services, actually have begun a pop-up childcare centers that are located throughout the county. These centers are located actually close to hospitals when at all possible, and they're serving students from infants all the way through high school. It is definitely a privilege to find ourselves in a situation to support these healthcare workers who, if they don't have someone to provide childcare, they're not going to be able to do their job. So healthcare workers were the first people that we've been working with. This has now been expanded to other first responders, law enforcement, fire, etc. And then we actually, as we sort of roll this out, we're going to be offering for others in our community that are first responders, whether it is somebody who works at the grocery store, the laundromat, the gas station, etc. So we feel really good about that. And actually tomorrow there'll be a statewide conference call with all of the other county superintendents in the state. So we've had the chance to have a soft launch, which was last Thursday, but we've been able to put into play the structures that we think keep staff and children safe. So we'll be sharing our work with the entire state tomorrow.
That's terrific. We've got another question for you, Mary
Sure.
Jane. Anne asks, how is it safe to provide childcare at school sites? And how is that different from just keeping school open for kids?
Sure. So Lisa, maybe you could help me on this one, but just the bottom line is the protocols are very, very specific. So we are not just opening the schools first. It is just for this emergency. It's for these emergency responders. So that's really important. But it is through very specific parameters. One is that the number of students we can serve is a total of 12 students. It has to be a stable cohort, so not having kids coming in and out in a single classroom. They will not be congregating with other children on the site or sharing the playground by way of example. Very specific protocols before a child can enter. They're actually make sure they don't have a fever, they have no symptoms.
And you're working with public health on all
Absolutely.
this. So Dr. Santora, maybe we should invite you to sort of speak to those protocols, and can you give folks a comfort level that it's going to be safe?
No, of course, and we worked with our public health nurses to provide infection control education to staff, so we're ensuring that it's a clean and healthy and safe environment for the students and the teachers who are on campus. The real strength that we have is having that cohort control or cocooning that group of kids. So even if only 8 out of 12 children can attend, it's a stable 8 people, so we're able to control that grouping of children.
Terrific. Well, the next question is from Dave in West Marin, and Dave is, here's Dave's question. This weekend, West Marin and Sonoma Coast were inundated with Bay Area visitors. It was unsafe, and we don't want people coming to our rural areas. And so this question was directed to me. I hear you, Dave. In fact, just yesterday, I had a conference call with all the public land managers in Marin County. I spoke today with the chairman of the Board of Supervisors in Sonoma County on the same subject, and I spent a good part of this morning reading about how as much as this impact was felt in West Marin, it actually was felt all over the world this weekend. Even in England, folks from London wanted to get out into the British countryside, and they inundated these areas at a time when they were supposed to be observing social distance. So I think we learned a lot in a very short time about the importance of public education and providing frankly, some more specific prescriptions to make this thing work. Marin County, all of the agencies in Marin County, federal, state, and local, are now on the same page. Vehicle access is prohibited to all of our parks and trailheads and open space areas to address this problem. So what we're trying to do is obviously prevent crowding and also prevent the kind of traffic impacts that challenge first responders and others. If you can walk or bike to get your exercise from your home, you should still do it while maintaining social distance. We want people to stay healthy and sane, and that's another way we need to get through this. But don't drive to a place of exercise. And that's just going to be the golden rule, I think, going forward until further notice. There won't be parking, and it's really something we want to discourage. Sonoma County is right now trying to figure out whether they follow that same protocol, but I expect that that's what you're going to see statewide. That's what Gavin Newsom announced that they were doing at state parks and state beaches. So parking is gone. Vehicle access is prohibited. Get your exercise, but get it either in your own home or in a place that you can walk or bike to while maintaining strict social distance. Okay, the next question is from Sam, and it's for Dr. Santora. Sam says he's hearing conflicting information. Does it take 7 days or 5 days or 14 days to contract COVID-19 if we have been exposed to it, and how long will we really need to be in isolation when that happens?
So we know it takes up to 14 days for the incubation period. We're seeing for most people it's 3 to 5 days after they've been exposed that if they do develop illness, when they will develop illness. The 14 days is the safe period, as when we were in the beginning of the disease, of trying to identify an appropriate time to self-quarantine. We've shifted away from self-quarantine now with new guidance from Centers for Disease Control and Prevention. And so for an individual who does test positive for COVID-19, as long as they're at least 7 days from the time of symptom onset and have been symptom-free and afebrile for 3 days, they may return to work.
Thank you. Next question is for all of us, and it's from Susan, who asks about seeing people close together in stores and outdoors. How do we do essential activities safely, and how do we get people to comply with social distancing? Mary Jane, you want to take the first shot at that?
Well, I think it's our responsibility to say, whoa, right? To actually lean in with our friends, families, etc. I mean, if we each take our own personal responsibility, then I think we'll have a chance at this. But if we don't, then we're going to continue to see what we've been seeing.
Yeah. Lisa?
No, I just encourage businesses to look at strategies to stagger the entry of customers. We've seen successes, for example, at Costco, where they were just controlling the entrance of individuals, and that does help keep that 6 feet distance. If stores are going to allow individuals to come in and pack the stores, then we are going the exact opposite direction of what we need to do. And also for people to make decisions. They know their community, they know the businesses. When is the best time for you to safely shop and complete your essential services for your family?
Yeah. I will just add that what might have seemed awkward maybe a week or two ago is now the cool thing to do. You're not going to offend anyone by maintaining your distance. If you're walking on a trail or in an open space to get some exercise, step far away from your fellow citizen as you pass, and you're not going to offend them. They're going to want to be away from you too, because we've all got to get this through this together. So distance, distance, distance. Next question, Dr. Santoro, is for you. Carol asks, is this spread by air or droplets? What PPE do we really need? I hear hospitals need supplies, and I see people driving in cars with N95 masks on. Will you please break that down for us? Who needs what? And let me, if I could, just add to that. I have heard about some confusion from our nurses in my district, because they say that on the one hand, OSHA recommends that they wear N95 masks, but the CDC says that a normal, less invasive or less intrusive mask is sufficient. So what's the story?
So when this first started, we were still learning about COVID-19, and we took the most aggressive measures for infection control, which included droplet, airborne, and contact isolation. As we learn more about the disease, we're seeing that it truly is mostly transmitted through droplets. And with PPE, as we see people in the community, we're only recommending masks if you have symptoms. So if you have to go out and shop, it's an essential for you to do, to wear just a regular surgical or isolation mask, not an N95 mask, to prevent yourself from adding droplets into the environment. With N95 masks, there has been a shift, and it's again based on science. It's not based on anecdote, that we're seeing it's a droplet-based transmission, and that only individuals who are engaging in high-risk procedures would need to use an N95 mask. So now the recommendations are if healthcare workers are 6 feet away from patients, they do not need to use the N95 mask. I know it's hard though, because we started with such containment measures and we're shifting to mitigation, that it's hard for people to understand that. But we are just at the beginning of this, and we need to conserve our personal protective equipment.
All right, I appreciate that. The next question is from Gary, who says, why is there negotiating at this time of urgent need? People are dying and our government is negotiating? Doesn't make sense to me, is Gary's question. I think the negotiation, Gary, is, well, first of all, this is politics and this is Congress, and some of my colleagues are still in a little bit of denial about this crisis that we're facing. By way of example, we learned just this week that Senator Rand Paul tested positive for COVID-19. Well, just a few days prior, his own father had posted an article online calling the coronavirus a hoax and saying that it was all overblown and it was not something we needed to take very seriously. So I think we're beginning to break through the denial, and that's why you've already seen at least 2 strong bipartisan measures pass the Congress and get signed into law by the President, including an $8.3 billion emergency supplemental funding bill and an initial set of reforms to help make sure that testing is free and that folks get the care they need and that we're supporting first responders and healthcare workers. We've got a lot more work to do, and I think that the politics will really come into play when we get into the economic stimulus side of this. On confronting the healthcare crisis, I actually think Congress and the President are working fairly well together. But we know that at the end of this, we're going to have to try to breathe life back into the economy. And that's where we've got some differences. Quite frankly, Senator Mitch McConnell proposed some measures that would have benefited large corporations and provided a slush fund, frankly, for Treasury Secretary Mnuchin to dispense, kind of on a trust me basis. I know that most of my colleagues are not willing to trust Secretary Mnuchin to do the right thing with $500 billion. And so we had to negotiate an inspector general provision and other safeguards to make sure that this money benefits workers and folks who really need it and doesn't just become a slush fund for billionaires and corporations who don't need it. So those kind of things, unfortunately, are going to continue to be subject to negotiation. But I am still cautiously optimistic that Congress and the President will be able to get this done together and meet the moment. The next question is also for me. It's from Michael. And Michael asks, many of us here in Humboldt County are big Trump supporters and fans, and we need to see you working with him, not trying to make it more difficult. So just kind of continuing with what I was alluding to a moment ago. I've already worked with President Trump on 2 pieces of bipartisan legislation, and you have my commitment that I will work with this president on anything we need to do to get through this crisis. That's all of our job right now. Putting our country and our constituents first. But I'm not going to let him rewrite the history of what happened here. And I think holding this president accountable for doing his job and fulfilling his oath of office is also a critical part of our response to this crisis. The truth is, this crisis is worse because of the bungled initial response from CDC and because of some really irresponsible and I think indefensible actions that this administration has taken in the last few years to reduce our national readiness and our ability to deal with a pandemic like this. I'm not going to let anybody rewrite the history of that because, frankly, when we get through this, it may well be that the coronavirus pandemic comes back again in the fall. It won't be totally gone. And I think the American people and American voters need to have the facts before them so that they can go and cast their ballot in the November election fully informed about the kind of leadership that we need and that they deserve to get us through what could be multiple waves of this crisis. The next question is for Bill and me. Bill gets to speak now. He's our SBA representative here on the phone. Robin is asking, what about businesses that need employees to function and the activities aren't essential? So this is getting to that definition of essential businesses that is used in the shelter-in-place orders. How do these businesses stay open, and what kind of help can we provide them through the SBA? Bill, do you want to jump in on that?
I sure do, and hello to all of you. Congressman Huffman, I'd just like to say, as I get started, of course, I've worked throughout your district from the Oregon border all the way down to the Golden Gate Bridge, as you said. From salmon season closures years ago to the Tubbs fire and the Kincaid fire more recently. Glad to be here with all of you. The SBA has, am I coming through okay?
Yeah, you sound great.
Okay, good. The SBA is a federal agency that is offering disaster loans to small businesses impacted by the shutdowns and all of the other impacts of the coronavirus. And so hopefully you've got a slide about our program that is on the screen for those that are watching.
Yep, we're showing that right now. We've got phone numbers and email and yeah, all the stuff that you want us to see right there.
Excellent. The very short version of what I can say is any business that's impacted by closures and so forth, we're encouraging them to apply for a disaster loan with the SBA. These are loans for small businesses at 3 3/4%, 30-year repayment term, no cost to apply. So we are directing everyone to that web link on the slide, which is disasterloan.sba.gov. You can go in there and make application electronically. Because of the social distancing issues, the SBA will not be putting someone in every city across the country to try and help lead them through the application process. Instead, we are ramping up massively our pool of customer service representatives at the 800 number that you see on the screen, 800-659-2955. And then the third thing on this slide is an email address. So we want you to go to the website and apply if you're a small business. Private nonprofits are also eligible. We want you to call us at that 800 number if you have a question about the process or how to navigate the electronic loan application at the website. And if you can't get through on the phone, we want you to give us try to get a hold of us through our email address, which is disastercustomerservice@sba.gov. So the starting point for me is to say that in the last week and a half, as we've been ramping up our program to meet the unbelievable number of the businesses that need help out there. Yes, our website and our disaster loan electronic application and our telephone line have all been impacted. There have been delays. And so at the bottom of my slide, it says, please be patient, please call back. We will meet the need and we will be able to provide help, but some folks may experience some difficulty and they may have to be on hold longer than they care. I've been telling folks that if you contact us between 7 p.m. and 7 a.m., that's the best time right now. Perhaps tonight, though, our computer system is going to be undergoing some major maintenance, so that might not be true tonight, but it will be true going forward. And then lastly, I'll turn it back over to you. The state of California was one of the first to request a disaster declaration. The process is the governor asks the SBA to declare the disaster for the coronavirus. And because we did California's declaration a week and a half ago under our old rules, we only declared the counties in the state that the governor requested to be declared based on preliminary information. Some of the folks in the north of your district, up in Humboldt County perhaps, have called us and said, we heard there's a declaration for disaster loans for businesses. We went on the website and it said we're not covered. That has been resolved. All of California is now declared. So wherever you are, whatever you've heard, we want you to go to the website, give us a call, start the application process. And so the answer to the question is, SBA can help a business that hasn't got any revenue now or has reduced its revenue by providing working capital loans to help pay the ordinary expenses of that business, and that includes employee paychecks. So that's what the SBA can do. Back to you.
Terrific. Thank you, Bill, for that. And at the end of our town hall, I'm going to provide some contact information from my office as well. If you have any trouble getting through to the SBA, we can help you open that conversation as well. Next question is from Lane. And Lane says, my business doesn't qualify for SBA. Will there be additional resources for businesses that have to simply shut down? And I know a little bit about Lane's business. This is going to bring Bill into the conversation again. Bill, Lane exceeds the cap on SBA lending for the amount of money that would be necessary to keep his payroll. And then for the paid leave provisions in the action Congress took a week and a half ago, Lane's business has more than 500 employees, and so therefore that paid leave is unavailable to his personnel. So he really does find himself in between the cracks of the steps that we've taken so far. I'm certainly going to commit to doing what I can in this next wave of legislation to provide much more help for businesses and workers in situations like this. But Bill, do you have any thoughts from the SBA perspective?
Well, the first thought I have is that you see by the name of our agency, we're the Small Business Administration. Yeah. So yes, there is a limit. These loans are only available now to small businesses, and our lending program upper limit is $2 million to one business owner. So I've had a call this week earlier from someone who said we need $2 million a month for our outflow in expenses. So yes. This program is not designed to help every single business in America, but obviously 90% of us, I think, work for a small business, is one of the statistics. So I think that we're all waiting to see what the Congress and the President do regarding this next wave of assistance. I've heard a lot of rumors that our agency will suddenly find itself doing things completely differently, even more so than the last week. So I look forward to finding out what that might be as well. But as of today, we've got a $2 million loan limit per business, and that amount of money that we loan to a business is based on the size of the business and the cash needs that it has.
Great. Well, thank you for that. And I think I can safely predict that there will be more help available for businesses like Lane's. The trick, and this is again back to the negotiations that'll be taking place, is we want to provide broad relief and not just loans. We know that some businesses are going to need forgivable loans or even grants, in addition to all the direct support we need to provide to workers and families. But we're going to have to do that in a way that doesn't reward bad actors. We're going to have to make sure that we don't provide blank checks that can then turn around and be used for stock buybacks or for executive bonuses. We've got to think about industries that are clamoring for bailouts right now, like the cruise ship industry. They've got close connections to this president, but the truth is the cruise ship industry flags its vessels in other countries to avoid paying U.S. taxes. They've got a terrible environmental and labor record. They typically hire folks from other countries in order to avoid our labor laws. And so I think we've got to be very thoughtful and targeted as we provide sector-specific relief, especially given the fact that some of these industries have gamed the system in the past and are not particularly good corporate actors right now. But we'll do everything we can, certainly for Lane and others who are good corporate stewards. The next question says, it's from Leslie, please remind people to take the census. What a great reminder. Thank you for that, Leslie. We're all stuck at home. It's a perfect time to dig out that census form that hopefully everybody's received by mail. And I don't have the census website right at my fingertips, but I think it might be census.gov. We can correct that if I need to. But you can get any other details, or if you haven't gotten the form, you can find out how you can get your hands on it. And it's a great time to make sure we're all counted. That really matters. Counting everyone certainly matters in probably public health.
Mm-hmm.
I'm sure in public education. Do either of my fellow panelists here want to speak to the importance of making sure we get our fair share through a full and accurate count in the census?
Absolutely. If we are undercounting our population, particularly our highest need population, this can be thousands and thousands of dollars for this community now and into the future. So we have a full push going on. A lot of people who've been trained, and there's some worries right now about how to get people's eye on that ball. So we should do everything we can to make sure that every single person is counted and that we do our part for sure.
Doctor?
No, I completely agree. We want to optimize our counts in order to draw down the resources that belong in Marin County, especially for our most vulnerable residents.
Terrific. Let me go to the next question, and it is from John. So, Dr. Santoro, I'm going to go to you with this. The question is, what about blood drives? And I will just add that I have heard that our blood banks actually are in need of donors, and that this is something that most people can do very safely despite our concerns about the coronavirus. What can you tell us about that?
We always encourage people to donate blood. It's a great gift to our community and to our healthcare system. At this time in our EOC, our Emergency Operations Center, is not our top priority, but it is on our list of things to check as we start engaging in medical surge preparedness.
All right. Appreciate that. Another question for you, Doctor, is from Gary. Will the old Fireman's Fund office complex be used as a medical center during the coronavirus pandemic? So this is a bit of a Marin-specific question, but whether it's Fireman's Fund or other infrastructure that we might be able to tap into, what are we doing to make sure we'll have the bed space and the resources?
Right. Counties across California are looking at resources to prepare for medical surge. For example, we are meeting with our hospital leadership twice a week to discuss this particular issue. How can we prepare the hospitals to receive more patients? How do we make sure they have the supplies and the staff that they need to care for patients? And how do we look at alternate care sites to provide care? And that's also in conjunction with our skilled nursing facilities and long-term care facilities, which we know are very vulnerable populations, and working together with them to develop a community plan for medical surge.
Okay, terrific. Let's go to the next question. One of the factories that this is from, we don't have a name for this question. One of the factories I work with makes surgical masks. Would you like an introduction and a contact name for this factory to order supplies? So, Dr. Santoro, this is obviously for you. but it's also an invitation to talk about how the different counties and the different healthcare providers are taking care of their inventory needs.
Every county has the same system, which is a beautiful thing about California. So in Marin County and counties across California, we have a medical health operational area coordinator position that organizes and coordinates all these efforts to increase supplies in our community. And so that would be one space that, for example, we have developed a form to provide information about possible donations into our healthcare system, and we'll be providing that publicly in order to organize for our community, but this is happening across counties across California.
So every county public health department is going to have some kind of a process for these offers of help.
Yeah, we're really fortunate in California in that we're advanced compared to other states in this medical health coordination system. Marin County is part of Region 2, so anytime we need additional resources, once we deplete our local and county resources, we can make a request up to our Region 2. If Region 2 is unable to fill that need, they can make a request statewide for additional resources. So it's a tested system that unfortunately we have had to use because of the firestorms in the past.
And while we're on this subject, I know that, for example, these daily press conferences that we're seeing from the president and his coronavirus task force, they throw out all of these numbers about, we've gotten all these additional masks and ventilators and so on. And my understanding is that those are then allocated on a priority basis to the different states and their public health directors, and then filter down to the local level from there. Have I got that right?
Correct. And then each county can access these resources through that medical health coordination system that we have.
Okay. So if you are a hospital or healthcare provider that has a need, a critical need, you got to work up through your public health at the county level and your state public health to try to get in line to hopefully get some of these new resources that are coming online.
Exactly, and that's why we've been working closely with our hospitals so we can anticipate needs and get in queue quickly. We find that getting in line first does help, so having advanced planning and working with our Office of Emergency Services and counties across the state are doing the same thing in order to identify where are the gaps in our system and what are the resources that we need to request, and what can we honestly fulfill ourselves right now by working with local businesses and partners, which is a win-win for our community.
What about well-meaning individuals who maybe find a case of surgical masks that they might have had for some construction job or something and want to drop it off at the right place?
So that's a challenge for us. We saw that with the fires as well as donation management.
Yeah.
We don't get what we need. We get a lot of stuff, and it honestly can tax our system when we're trying to prepare for surge. We're using a Google form. We're using technology to kind of review the submissions of donations at this point, so we can identify those that will be used purposefully in our system.
Okay, well, thanks. Next question. Let's see, we're just checking the Facebook questions coming in, and I've got one from Pam Stafford, a Roanoke Park City Council member. Hello, Pam. And it's for me. With your consideration of a stabilization fund, I urge you to send money directly to cities. We would hate to see necessary money not get to the source because of dilution at the state level. So thank you very much, Pam. And having been a state legislator, I understand that there are administrative costs that seem to get taken out as things filter their way down to local government. So I'll try to do my best to make sure we are getting the money directly. But I will tell you that at least the top lines I've seen from the package that seems to be coming together back in Washington today, it talks a lot about local government, and I'll look into the mechanics of how we're getting that money to local government. Next question is from Richard, and it is for Mary Jane Burke. Richard asks, how are schools meeting special needs? My child has an IEP. How is that going to work?
Yes. So what's happening throughout the state is that people are looking at the individual needs of a student through their IEP and doing everything that they can to provide services. So right now, over FaceTime, you can see counselors providing counseling services, speech therapists continuing their speech services, teachers being in daily contact with the students as well as their parents, and providing a myriad of activities that continue to support teachers, some that are actually doing some home visiting of the individual child, which can work within our protocols. So there's a lot happening in this area. The federal government and the state state and the locals throughout our state are very clear that this is a time when we have to make sure that students that are the most vulnerable are not left to the side. So there's a lot happening.
Remote learning is a challenge under the best of circumstances.
Right, absolutely.
But with respect to highly individualized IEPs, and as a parent of a special needs kid, I'm pretty knowledgeable about this myself.
Right.
It's tough.
Yeah, and hopefully you're seeing some very direct contacts with the teacher and your son, right? Or paraprofessionals and their son, or the other specialists that might be interacting. And so I'm trying to make sure that it's very, very individual.
Yeah. So thanks for that. The next question is, what will happen to high school seniors and graduation? What will this do to college applications?
Okay, so this is a great question, and so I want to assure you that our colleagues, whether it's Mendocino, Humboldt, Sonoma, we are collaborating each week multiple times around issues like this with both our state superintendent as well as the governor's office to try to see how this is going to work. Issues like grading, how are they going to, what are the grades going to look like? What are we going to do to make sure students graduate high school? What about the testing that's being set aside? And so we are actually expecting guidance from the state coming up as early as this Friday to sort of help. What I want to assure you, though, is that the plan is that students are going to be able to move forward for sure.
Nobody's going to repeat their senior year of high school.
Students are going to get to graduate.
A bad dream.
I know, are going to be able to graduate. They're going to be able to, go to college. They'll have opportunities to look at what their grades are currently to try to make sure they can boost them in this next period of time if they need to. And then also we're already talking about how do we, this is the class of 2020, how are we going to make sure that we mark this class? And I will tell you, there's a lot of young people throughout our area that are working hard on trying to figure out how they can make a difference and using a lot of their energy in support of tamping down this virus, helping young people understand the importance of distancing, etc.
It is going to just leave a permanent, indelible mark on people's lives, and young people in particular. I can't help think about the congressional art contest I have every year. I've just put out the requests for high school students to submit their art projects in response to this contest, and I get amazing creative works from high school kids all over the district. I am going to be curious to see if this pandemic finds its way into their artwork in the weeks ahead.
Yes, absolutely. I bet it will.
They're going to be thinking about it.
Sure.
All right, the next question is for me. It's from Nancy. Will we be switching to vote by mail for the November election? We should, Nancy thinks. Nancy, I agree with you. I think the more I understand about this pandemic, and I'll invite Lisa to correct me if I get any of this thing wrong, we may see a decline in the spread and decline in even the positive tests as we go forward into the warmer months. Some of that will be because of our flattening the curve. Some of that will be because viruses like this slow down in warmer months. But it doesn't mean it'll be gone, and it's likely to come back in the fall and in the colder weather. That's right when we're going to be having a really consequential national election. So I think we've got to anticipate potential disruption of the election. And I will tell you, I don't mean to sound too political here to the Trump supporters who are joining us, but I'm also very worried that this president, given his authoritarian tendencies, may use any kind of a national crisis or pandemic to delay an election, especially if it looks like he might not win. So it just makes sense on every level for me to make sure that we secure that national election, that we make sure it absolutely happens, that it can't be interfered with, and that people can safely exercise their right to vote without violating social distance requirements that may be in place at that time. And the only way to do that is with all-mail balloting. Now, the good news is that also is a great way to secure your elections because it provides a paper trail. It's pretty much bulletproof in terms of interference by foreign countries. And it has shown that it increases turnout in states like Oregon where they've moved to all-mail balloting. So it makes all kinds of sense. And we are pushing to include that in the next wave of legislation. From what I'm told today, our Republican colleagues rejected it in this next package. And so you're not going to see a national vote-by-mail mandate or the kind of financial support for states that I want to see, but we're not done. We're going to make sure that there will be a fourth and fifth wave of legislation from Congress. It absolutely has to be part of our response, and I'll commit to you to doing everything I can to make sure that it is. The next question is for me from Robert. Congressman Huffman, thanks for the invitation. Please prepare to explain to us why Senator Dianne Feinstein and her husband made a killing in the market with insider information. And Dan W. asks, what about the senators that profited from dumping their stocks? Okay, so let me first tell you that your congressman does not own any individual stocks. So my modest financial status kind of takes me out of the conversation when we talk about these multimillionaire, billionaire colleagues that I sometimes work with who have these enormous portfolios. I don't know why any member of Congress needs to own individual stock. In fact, I think it's a terrible idea. And I think that there should at a minimum be a blind trust requirement, and maybe even more than that. Maybe they should be required to put their money into mutual funds so that you just never have to worry whether they're gaming their public trust to enhance their own bottom line. And I would say that about our president as well. This is a president who promised to put all of his business interests into a blind trust and then turned around and broke that promise when he took office. And right now, he refuses to rule out his own family business benefiting from bailouts that he may be advancing and supporting in the weeks ahead. So we got to do much, much more to put strict firewalls in place. You asked specifically about Senator Feinstein. My understanding is that her situation was actually very, very different than Senator Burr, who actively traded on confidential information and saved himself tons and tons of money. My understanding, and let's all look at the facts and hold everybody to the same standard here, this shouldn't be partisan, but my understanding is that Senator Feinstein did have arm's length, and that actually the trade that happened during that window, she lost money on and didn't save money. So let's look at each of these on the facts, and let's hold everybody to the same standard. Let's also try to push forward some reforms for the long haul so that we never have to even have these conversations. It's not something any of us should ever have to wonder about. Next question from Carol. Why is Congress on break? So Carol, it may get referred to as a break in the media. I promise you I'm working harder than ever to try to address this crisis. I'm just doing it from an extra bedroom that's been repurposed as a congressional office. And the same goes for all of my colleagues around the country. We're spending huge amounts of time on inefficient and sometimes frustrating conference calls trying to do the business of government. And as soon as we can safely get back physically to our offices and even to Washington, we'll do that. We want to do that, but we are not on a break. The next question is from Bonnie, who asks, if it does come to pass that all Americans will receive $1,000, will people with green cards be eligible for this money? I don't know the answer. I think it depends, Bonnie, on the kind of individual assistance that materializes. And I haven't even been able to read the bill. There is, I believe, $1,500 of direct individual economic stimulus in the bill that is under negotiation right now, and then another $500 per child. I don't know whether someone with a green card would qualify or not, but I will look into it. And I think I want to say in response to this question also that my guess is that this initial wave of direct individual assistance is not going to be nearly enough. When I think about what is likely coming for our economy, I think we're going to have to do a lot more in the weeks and months ahead. So next question is from Paul, who asks, we have no real idea of the consequences of this national shelter-in-place policy in the medium to long term. We may lose many more lives than would be lost to COVID-19 as a result of a major economic devastation, or would we lose is the question. And so I'm going to invite Lisa to speak to this, but I am beginning to see a few folks suggest the president himself used the term, let's try to make sure the cure is not worse than the disease in some of his recent comments. And he seems to be fixating on trying to reopen the economy, as he puts it, by Easter, a rather arbitrary date that he has put forward. My feeling is that the only way to revive the economy is to control this pandemic. And if you think otherwise, it's like trying to negotiate with the law of gravity. This pandemic is going to win that fight. It's going to win that argument, and it is going to shut down our economy even worse if we don't take it very, very seriously right now on the front end, even though there are tremendous economic hardships associated with that. But Dr. Santora, please, you're the public health expert. Let me give you a chance to explain that.
Now, we understood the severe impact this would have by having Bay Area health officer orders around staying at home and sheltering in place. And it wasn't a decision made lightly, especially for the most vulnerable residents of our community. But we knew that this was the measure that we had to take. We have learned from other countries how they have been successful by having strict containment measures, for example, Taiwan and South Korea. And for us, we knew that that is the way we could protect the health, well-being, and safety for the Bay Area and for the state of California, not just for now and this immediate time, but in days and months to come and years to come. And this is an unprecedented time. Never in my career have I seen anything like this. And I've been through SARS and H1N1. This is different. And I think some people believe there was a force field around the United States and that it wasn't going to hit us. And that is not how we've been operating. Our concept of operations is that we were going to be impacted just as severely as other countries, and we need to prepare for that.
Well, and if you look at the curve, the transmission curve, it looks like we may be the most severe as of the last few days and the trajectory that we're on. We're hoping to flatten that curve, but as of this very moment, the information I've seen doesn't look great. Do you want to speak to some of these suggestions that we're beginning to hear about, that maybe younger people can be allowed to go on with life, business as usual, or maybe we can open up, regions of the country while keeping others under shelter in place? As a public health expert, what do you say to that?
No, this affects people of all ages, and we're now seeing severe disease in young adults and Olympic athletes. And our only ability to control this disease right now is by staying at home and limiting the spread. We're not going to stop the spread of this pandemic. We're going to hopefully flatten that curve and have less ER visits and less hospitalizations. But it is going to affect everyone of all ages. And we'll see that when people visit California, who has been one of the earliest states to have a shelter-in-place quarantine, and come and visit us from states that did not have that, that will be reintroduction of this virus into our community.
Yeah, that's really why we need to make sure that this is, ideally a national policy.
Right. And yeah, it's disheartening to see. I lived in Miami, and it's disheartening to see people gathering on one of my favorite beaches and frolicking, which is a great time to do many other years, but this is not the year to do that. And really, for us, it is that social distancing that's going to flatten the curve. It's going to protect our resources and get us to the summer, which we are optimistic about getting to the summer.
So what about this point that some people are raising, that the economic dislocation is so extreme, and we're talking about potentially 30% unemployment, some are suggesting in the second quarter. I mean, these are numbers like we haven't seen since, the Hoover administration.
Right.
Some people are suggesting that is so extreme that we should just let this virus go and everybody fend for themselves. What does that look like if we were to pull back and just let this virus go?
If we were to pull back, I think we already would have seen a major surge into our hospital systems that are not ready to receive it. And we have not been practicing the orders to perfection yet. So people I think only now are starting to see the importance of sheltering in place as they're seeing the numbers increase in their communities of confirmed COVID-19 cases. But we also, in our emergency response system, we call it our care and shelter branch. And just like with firestorms or earthquakes, we're standing up our local assistance centers. So we have our small business administration working on their end. We also know that in health and human service agencies across the state, we work with very vulnerable populations that may not have a small business but are being affected economically. And so also we're seeing foundations across the state build up funding to, again, fill in those gaps where the SBA might not be able to meet the need, the federal funds that come down to support people might not be able to meet the need, but us as a community can work together to support our communities.
So just before we leave this subject, on the public health side of things, my understanding is that if you were to just let this run and not take these measures, you would rather quickly overwhelm our healthcare system, literally crash our hospitals and clinics. You would expose all kinds of healthcare professionals. A certain percentage of them would be lost to the workforce. They'd have to quarantine, or they might themselves be casualties of this virus. I sometimes I think we get a little selfish with this issue. We think, some people might think I'm young and invincible and I'm not going to die from the coronavirus. Why do I have to do all this stuff? If you want to have a healthcare system where doctors can treat sick people and we can have hospitals with their lights on, you just have to do this. Am I wrong about that?
Absolutely. If we can keep the prevalence of this disease low in our community, those essential workers that have to go out there, be it healthcare workers or first responders, are going to be safer. And we run a great risk of just our workforce in general. If we are furloughing individuals just because they're sick, not just because they're sick, then we are not going to have the staff in our healthcare system and in our hospitals to care for patients the way that Americans expect to be cared for.
Right. Thank you. So folks who are following us right now, I'm going to take the liberty of going a little beyond the 1 hour mark, if that's okay, because we're, I think, having a real productive conversation. The next question is for myself and for Bill from the Small Business Administration. And it's from Cheryl, who asks, what about restaurants? One thing we need is for insurance companies to provide loss of business coverage. I was told by my agent today that only one county has declared a natural disaster, Sacramento, and that this may allow businesses in the area to file claims. We all need assistance. We all need financial relief in the form of grants, not loans. I hear you on that, Cheryl. We're working on that. What will the community look like by summer 2020 with no restaurants, no bars, no music? None of us like to think about that scenario. But Bill, let me invite you to speak to this matter of disaster declarations and how that might implicate the financial support from insurance coverage for some of our small businesses.
Thank you. The word that we've heard as of last week is that business insurance coverage for interruption isn't going to be covering the coronavirus. That's sort of a general overarching concept that we were advised. And so as of now, SBA isn't expecting to see any offsetting business interruption insurance payoffs come in to the folks that we're looking at for a disaster loan. So I really can't speak to what the insurance industry is going to do, obviously, but the SBA is not anticipating there to be those kinds of offsetting dollars. Another thought that I've had listening to the conversation is, in addition to SBA's disaster loan program, the SBA also funds other resources that are available within the communities for free. And so for any small business that's impacted, that's reeling, that's trying to figure what to do, even whether or not to apply for a disaster loan from the federal government, let me offer to refer you to your local small business development centers. We have an organization called SCORE, which is retired executives offering counseling for business owners. There are women's business centers, and we have veterans business outreach centers. This is all in addition to your local chambers of commerce. To get a hold of these folks that SBA partners with, I would refer you back to our website, sba.gov, and this time go to sba.gov/local-assistance. Local with a hyphen, local-assistance. sba.gov, local assistance. Hope that helps.
All right, terrific. Next question, back to Mary Jane Burke, because this is about education. Students are being asked to do remote learning. Right. And I obviously represent some areas where that's possible. My own home, we've got me doing my job and my wife being a teacher, providing remote education, and 2 kids doing remote learning. We have a good internet connection, but I've got a lot of communities that are underserved and don't have that luxury. I might have some folks joining us tonight from the Mendocino Coast where they have terrible broadband, or from Humboldt County or Trinity County where there's not much redundancy and the connection's not great. So how do we provide equal education to kids during this period where we're assuming that they find ways to get online and do remote learning?
Mm-hmm. So the assumption isn't that everyone's getting online. So there are districts throughout the state and throughout the area that you represent that are providing packets for students to ensure that there is access for all students to materials and learning. In addition, though, school districts are working to find the resources when they can to actually get individual hotspots. So for example, the free library happened in our community is providing some support in that area. Our local foundation and others in your area are actually providing support specifically for this issue to ensure that there are hotspots available. So we have a lot of people working on these issues, but this is a bigger issue than this pandemic.
Oh, yeah.
This is the issue. If we really do care about equity and access, we have to make sure when we're not in a pandemic that we're dealing with this. This is such a concern. So we have a lot of people working on it right now, but I think we all need to acknowledge this is an issue for all of us every day, all day, not just during this pandemic.
Yeah, and let me just add that at least in the House bill that we're putting forward, you're going to see a slightly different package get negotiated out of the Senate today or tomorrow. But there's a House bill taking shape that absolutely addresses this.
Great. That's great.
This is a crisis, and they say every crisis is also an opportunity.
Yeah, exactly.
So fixing our broadband challenge should be part of the opportunity side of getting through this crisis, and we're going to try to provide a lot of federal resources in this moment to help do that. So Dr. Santora, back to you. Gary asked, when will we know if people who get COVID and recover are actually immune? Talk to us about that, individual and herd immunity, if you would.
It's going to take us time. This is a new disease for us. It's acting differently. It's more severe than your common flu. And so it's just going to take time for Centers for Disease Control and researchers from academic institutions across the world to begin studying patients and collecting blood samples after infection and then publishing those research studies in peer-reviewed journals. And that takes time. We have seen a tremendous push by all of our medical journals to get information out as soon as possible to providers to inform treatment, but it's going to take us months to really understand this virus and how it behaves in our communities.
I think a lot of people assume if you get it and you get over it, you're bulletproof and you can just stop worrying about it.
No, early signs are that it's rapidly mutating virus, and so that means, and it might be more rapidly mutating than our flu viruses, so that means we shouldn't expect that. Just because we contract COVID-19 and we're one of the first, we still need to remain vigilant with our families and our behaviors. Our behaviors are our downfall, and there's so much we can do just to protect ourselves all season long. And again, another silver lining is people have really ramped up their hand hygiene and respiratory etiquette. And we need, just like with an equity issue, our systems are affected all year long by bad behaviors and a lack of attention to equity. And we can take this as an opportunity to improve how we function in our communities and society. When
we do get through this, we're going to be a much more sanitary nation, aren't we?
We are. And I think we're, just speaking of children, I have a 7- and 9-year-old. I think we have a new greatest generation ahead of us. They think differently than us. They're going to experience something far beyond what many of us ever could have imagined in their lives. And they're going to solve problems in ways we could never have foreseen. And that's another silver lining for us.
Yeah, for sure. So the next question is from Humboldt County. The question is, I live in Humboldt County where we just have one confirmed COVID-19 case so far. The person recovered. And I am concerned about tourists bringing the virus to my community because they're staying at Airbnb. And we had a question earlier about the West Marin visitors. I hear the same thing happened in Humboldt County and Del Norte County from folks in the Bay Area deciding that they could just take their family on a vacation up north. So the questioner says that there's an Airbnb up the road from her home, and I would like to see Airbnbs closed down for the duration of this pandemic. Is there anything you can do? Or is there someone else I should contact? I feel my own county board of supervisors will just want to protect tourism. Okay, so it's a question that I'm getting from lots of people right now. I think the specific rules involving vacation rentals is always subject to local ordinances primarily. So you're probably not going to see this addressed, certainly at the federal level through congressional action. But I think it's absolutely a conversation that needs to happen in each and every community, especially ones where they're seeing these kind of impacts. So I know that you don't want to bring this back to your Board of Supervisors, but I think that and your local city councils where I'm sure they're beginning to think about the implications of continuing to allow vacation rentals during this crisis. That's where that needs to happen. I will just add that, as I understand our statewide shelter-in-place directive from Governor Newsom, this is not okay. That would specifically violate what I understand to be the statewide shelter-in-place. So enforcement may be the real question at this point. Next question is from Peggy, who asks, what about seniors and their financial security? I think this is a question for me. And let me say that I have been pushing to make sure that, probably the fourth or fifth wave of legislation, since we're going to likely push out a third wave bill in the days ahead that won't do enough on this subject. But in one of these next steps, we need to include our vulnerable seniors. We talk a lot about the cruise ship industry and the hospitality industry. We talk about sectors and industries, but the part of our country that's been the most vulnerable and hit the hardest from this COVID-19 crisis is our senior citizens. And they also have financial insecurity as well. So this is a great time to think about how we could shore up the Social Security system, for example. And I am going to be pushing to try to include a bill called the Social Security 2100 Act. I'm a co-sponsor with John Larson from Connecticut. And it would make a few basic changes that would stabilize Social Security for the next 100 years and also increase the benefit for seniors because we know that it hasn't kept up with elder inflation, you might say. There are unique inflation factors like the cost of medicine and other things that actually outpace normal CPI inflation measures for seniors, and we just have to do a much, much better job modernizing Social Security, both to stabilize the finances, but also to bring the benefit side up to match the actual need. And I promise you, I'm going to keep working on that. I think, unless the screen posts another question, I think the team back in the other room may be telling me we have reached the end. They got one more question, so bear with me for 1 second. All right, this is a question from Joe. China and South Korea took extreme measures to test and contain, and the U.S. is well behind on those sorts of measures. We seem well on the way to having the same outcomes as Italy is now experiencing. How can we move from containment to mitigation? So, Doctor, back at you on this, but I certainly saw some statistics and some graphics today that caused me to have the same concern, that we may be a lot closer to the Italian experience than to South Korea and Singapore and some of the others.
Absolutely. This has been one of our top objectives since we opened our Emergency Operations Center, is to increase our capacity for testing. Testing is key. When we're able to test people and confirm if they're positive for COVID-19, then public health can do its work. That's when we initiate contact investigations and contact tracing, where we're providing one-on-one consultations with individuals and families on how they can quarantine at home safely and remain safe, and then identify other areas in our community where they may have exposed other individuals, either at schools, which are now closed, or workforces. And so that's our job, and it's been pulling blood from the stone a bit, trying to do that. We've been very creative about identifying solutions in order to increase testing in Marin County, but there are still some major rate limiting steps that your public health officers can't change. So for example, we've been able to change how we collect specimens, but we still need receiving labs to process those tests. And we've been successful at working with some of our commercial laboratories, but they are still back-ordered on the testing supplies. Yeah. So there's supply chain challenges that we, as much as we do, we can't overcome at this point. So we really are depending on a national effort in supporting our commercial labs going live. We've seen some great successes locally. Kaiser Northern California Laboratory is now testing and increasing testing capacity. The last time I heard was 1,500 tests a day. And as we can keep increasing that testing capabilities, and local hospitals are also initiating testing, as long as we can increase that testing, then your public health system can respond by completing contact investigations like we would have ideally been doing a month or so ago.
Yeah. So talk to us a little more about the testing, because my understanding is that it still takes, in some cases, several days to get your test result. And we would hope to get to the point where it would be maybe several hours at most, if we're going to really use the power of this testing tool to get this under control and to go into play. Dr. Fauci today, for example, talked about the fact that even in regions that you might think don't have coronavirus, until you do the testing and sort of shine a light into the darkness of no data, you don't really know. So rapid testing is the only way to really to do that effectively, right?
Absolutely, and we're seeing variability now. So we're seeing with our state laboratory, we're seeing a turnaround of less than 24 hours, which is excellent. There were stalls in the beginning, and it was just because, honestly, when the Grand Princess cruise landed at our port, they had to take on testing a significant, unexpected number of people that were not all California residents in order to navigate the next steps of quarantine at a federal level. And so now, since that work has been completed, we're seeing rapid turnaround at our state labs. We're seeing delays in some of our commercial laboratories. And again, there's many steps. It's not just collecting that swab. It's having laboratory staff that are trained in order to complete these procedures. It's having the machinery that's necessary to ramp up and complete this. And I know everyone's trying. We're seeing, I think, again, it's another great opportunity. The silver lining is there are entrepreneurs in our community that are developing rapid testing, and as much as the FDA, as well as other federal regulations can support entering these onto the market, and also in a safe way, knowing that they're effective and they're validated tests. The other problem would be having false positives and false negatives in our community that would be detrimental. So I know everyone wants to speed up, but sometimes you need to go a bit more cautiously in order to ensure that the testing that you are completing is accurate.
For those of us that want to imagine what that's going to look like when we eventually can validate those new tests and make sure they're safe and accurate. Right now, we have this first generation tests that involves, reagents and outside laboratories and things like that. Is it fair to assume that we might have something that is much more of a do-it-yourself test, using iPhone-based technology and other things eventually once we get this down? I hear tech companies, for example, talk about that.
I don't think we'll get there that fast. What I do think we'll see is it will become like a rapid flu test or rapid strep test that's very available and quick in both doctors' practices and in the hospital, that you have a turnaround within hours that can really inform your care. And that's where and again, that's why buying us time now to allow those tools to develop, even though in the future I don't necessarily seeing, shelter in place every fall for COVID-19. It's going to be us adapting to this new virus in our ecosystem, but we need to buy time now so we can develop both the tools for testing, rapid testing,
and the vaccine.
The vaccine for using. And it's concerning to me because even right now, only 43% of people get the flu vaccine is the tool that's available to them, and then potentially develop treatment and that takes us time. So ideally, in these first 6 months, we are protecting and sheltering in place and following those orders to buy us time so our healthcare system can shift.
Terrific. Well, folks, we went 15 minutes over. I want to thank everybody for sticking with us. I think there was a lot of valuable information. So I really want to thank my panelists for joining me. Thanks for all the great questions we got from all over the district. Again, if we did not get to your questions, I want to promise you that I will begin doing these Facebook Live events every week, and we'll do our best to get to you. Before we close, I just want to share one of the things that has been encouraging and inspiring to me here in my district as we work our way through this crisis. We have folks stepping up all over the place. Right here in front of me, you see this little hand sanitizer? This is from a Marin County-based company called EO Products. They are staying in business and actually dramatically increasing their production of sanitary soaps and hand sanitizers and making it available to all sorts of nonprofits and others, in many cases for free. That's just incredibly good corporate citizenship. The Buck Center and BioMarin, Dominican University, they're all stepping forward to make their facilities and their supplies available to county public health. Up in Sonoma County, Medtronics is beginning to produce some ventilators, as I understand it. In Humboldt County, Cocatat is looking at making PPEs. So there's incredible examples throughout my district of people who are stepping up. And even at the neighborhood level, I'm hearing so many reports of people checking on their elderly neighbors, helping deliver food. And that's really one of the key ways we're going to get through this, is by being in this together and helping each other out. So for more information on anything that we discussed tonight or any of the resources that were mentioned tonight, I want to direct everybody to my website. It is huffman.house.gov. And if you go there, you're going to find, first of all kinds of information about the coronavirus or COVID-19, including all the latest stuff from the CDC. But you'll also find my district office phone numbers and contact information, and we want to help you. If you have questions, if you have follow-up, for example, on SBA benefits or family leave or other things that Congress may have done, and you want to know how it might apply to you, we're here to help. I know that we can get through this together, and I hope that we have given you some tools to help do that through this conversation tonight. Thank you so much, and thanks again to my panelists for
Sure.
joining me. Be safe, everybody, and we'll talk to you soon.